Hello everyone, warm greetings. I'm Dr. Pranjali Thakur. I am Assistant Professor in Psychology at RV University. So today I'm going to talk about a very important topic which we really don't discuss much about, which is mental health. So now I would want to take some of your time and speak about what mental health really is, why is it important, why does it matter, what are some of the common mental health disorders, and what are its early signs and symptoms, and why seeking treatment is important in this case. Health refers to our emotional, psychological, and social well being. It affects how we think, act, and behave in our day to day life. It also influences how we react to stress, how we handle stress, and how we make choices in our day to day life. Just like physical health, mental health is also very crucial in our lives. So, when our mental health is good, we feel more resilient, we can cope up better with the stresses in our life, and we can work more productively and also contribute in a more helpful manner. But if our mental health is suffering, it also reflects in other areas of our life, be it our work, our relationship, our school and academic performance, and even our physical health. Now I'm going to talk about some of the common mental health disorders and their signs and symptoms. So let's see what are the common mental health disorders are. The first is depression. The common symptoms which are seen in depression are persistently low mood and sadness. Then there is a feeling of low interest in all the activities that you used to enjoy before. There's a fatigueness and low energy most of the time. There's changes in appetite, which is mostly low appetite and disrupted sleep or lack of sleep. And then there's a feeling of not able to concentrate. So your head always feels heavy or you always feel fuzzy, along with the feeling of worthlessness and guilt. The second common mental health disorder is anxiety disorder, which is commonly associated with excessive worrying, um, restlessness, and feeling fatigue, along with the racing heartbeat, and always feeling that you are living at the edge. Yeah. So the third disorder is obsessive compulsive disorder. The obsessive compulsive disorder obsessions are mental intrusive thoughts which comes repeatedly to your mind. For example, thoughts that you have to arrange things in a particular way, or thoughts that there is dirt or germs around you, along with compulsions which involves your physical activity to perform those acts in order to ease the anxiety. The fourth mental health disorder is psychosis. Psychosis is generally understood by hallucinations. So, hallucinations can be of two types: auditory hallucinations and visual hallucination. Generally, auditory hallucination is more common, wherein people can hear things which are not here, which when there is no actual stimulus present or no actual person is feeling, is present over there. And then there is visual hallucination, wherein a person sees people, or they talk or converse to another person when no one is around. So one another common symptom which comes under psychosis is delusion. Delusion in general commonly means as being suspicious. So person who has delusion has that constant feeling of persecution. Persecution generally means that people are trying to harm them or attack them. So the next and the last common mental health disorder is addiction. Addiction can be of any type. It can be either substance use or it can be behavioral addiction as well. Some of the common characteristics of addiction is loss of control of use over the substance of addiction, continuously using the substance or continuously doing some behavior despite having negative consequences. So the negative consequences can be social, or it can be in the areas of your job or your work. And then you also develop some tolerance, that is you need to engage more of that behavior, or you need to take more of alcohol in order to receive the same amount of pleasure. And when you are not taking the your and when you're not engaging in your addiction, it creates withdrawal symptoms. So withdrawal symptoms can be feeling of irritability, feeling of anger, and getting your addiction at any cost. So now that we know about some of the major common mental health disorders and their signs and symptoms, so if you notice these changes in yourself or in someone, it is time to take professional help for the same. So what kind of help can we avail? So the first line of treatment will be medical treatment. So medical treatment are very easily available. You can go to any psychiatrist and start with your medicines for these common mental health disorders. The medicines are extremely safe and they don't have much of a side effect, a myth which commonly exists among our society. The second line of treatment is counseling and therapy. So, how does therapy works? Therapy helps us in managing with the stress related to disorders in a much more effective manner. It improves the quality of life, helps to regain a sense of control over our life, and also establish a long-term commitment towards ourselves. Along with that, community and family support is equally important for improving our mental health.